Times like these have made us realize the importance of frontline workers. All the people forced to work during a pandemic are dealing with negligent customers, stocking shelves in our supermarkets, driving our buses, providing health services, the list goes on. However, not all frontline workers are visible. This is the case of meat packaging workers, many of whom have been affected by the spread of coronavirus in their workplace. Due to the spread, several plants in the country have had to shut down, affecting meat production. This is what you need to know. A report by the Associated Press explains that efforts from the meat industry in the United States to curtail the spread of the virus among their employees have resulted in slower meat production, which will eventually result in less meat in the market and higher prices for the meat that is available. Pork production has been the most affected. According to the report, 15 of America's largest pork packaging plants are responsible for 60% of all processed pork produced in the U.S. This means that when one shuts down, overall pork production is severely affected. As of last week, pork processing capacity has dropped 25%. The Associated Press reports the U.S. Department of Agriculture expects beef to rise in price by between 1 to 2%, poultry by 1.5%, and pork between 2 and 3%. So, will we be seeing a food shortage emergency anytime soon? Well, it doesn't seem so. Jason Lusk, professor and department head in the Department of Agricultural Economics at Purdue University, told the AP, by and large, there's been enough food. You might not get your exact variety that you want or the exact type you want, but there's been food available if you have the money to buy it. But what happens if meat production plants continue to shut down? Who will be able to afford meat then? If you think that privilege has nothing to do with how the coronavirus affects us all, take a look at how it is already impacting minorities in the U.S. It's probably no surprise for you all, but pandemics don't hit all communities equally. A new report by Politico explains how minorities are suffering from discrimination, even during a pandemic. According to Politico, Black and brown American communities are being heavily affected by the spread of coronavirus in the U.S. On top of that, not enough information on the spread in these communities is being collected, affecting efforts to ameliorate the situation. 5 Floridian counties stated that African American and Latino patients infected with coronavirus are being hospitalized and at times even dying at faster rates than white patients. According to a statement from Louisiana Governor John Bel Edwards, a little more than 70% of COVID-19 deaths in the state were from African American patients. However, not all information related to the testing and treatment of these minorities is being released, making it difficult for authorities to provide proper help to curtail the spread of the virus in these communities. Also, fewer individuals belonging to these groups have access to health insurance, further exacerbating the lack of information. Moreover, data collected by doctors at the universities of Virginia and Pittsburgh in collaboration with data tracking firm Rubix indicate that although thousands of individuals belonging to these minorities presented symptoms of coronavirus, they were not receiving testing. But wait, there's more. Some states aren't even recording ethnic data whatsoever. Examples of this are South Dakota and Nebraska, which ironically are states that have some of the highest numbers of COVID-19 cases registered. It's important to remember that it's not just the lack of data that's aggravating the spread of COVID-19 in minorities. This is a byproduct of socioeconomic inequality. Government data shows that poverty and unemployment rates are higher in minority communities. This lack of income is reflected on the health of African American and Hispanic groups in the U.S. Truth of the matter is that minorities don't have the same access to health care and suffer from higher rates of lifestyle-related health conditions like asthma, obesity, and diabetes that makes them more vulnerable to coronavirus. So what do U.S. authorities have to say about the lack of information on the effects of COVID-19 on minorities? Well, another report by Politico quotes a spokesperson for the CDC as saying, quote, "We are exploring using other avenues to supplement this information when possible." In other more positive news, Britain has started trials for Europe's first COVID-19 vaccine. Here's how it works. Oxford is starting human trials for the first coronavirus vaccine in Europe. Alyssa Granado is one of the first 2 volunteers to receive the experimental vaccine. Citing the University of Oxford, the BBC reports on April 23rd that the experimental COVID-19 vaccine takes the coronavirus's genetic material and inserts the substance into adenoviruses that are responsible for the common cold. The cold viruses are weakened so that they cannot grow inside the human body after injection. The modified viruses should make the human cells produce the same spike proteins that stud the surface of the coronaviruses and teach the immune system to recognize COVID-19. When vaccine recipients actually encounter the coronavirus, their body's immune system would then be able to identify the threat and scramble antibodies and killer T cells to fight off the infection. At the time of report, 2 volunteers have received the shot, out of around 800 recruited for the first phase human trial. Citing the doctors, the BBC reports potential side effects include headache, fever, and muscle pains a couple of days after the injection. Oxford professor of vaccinology Sarah Gilbert says she is, quote, very optimistic about the vaccine. However, Oxford Vaccine Group Director Andrew Pollard says the team is racing to catch the tail end of the pandemic to conduct the test. This means if Britain flattens the curve too fast, there might not be enough data to see if the vaccine actually works. So there you go. Don't get sick. But if you do get sick, it would be for the good of science. For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.